January is Cervical Health Awareness Month. Cervical cancer is highly preventable with regular screening tests and appropriate follow-up care. It also can be cured when found early and treated. Here to talk more about this subject is Dr. Paula Walker-King. So nice to have you here.
Great to be here. Thank you, Cheryl.
Yes, you're welcome. So first, what causes cervical cancer?
In the overwhelming majority of cases, the human papillomavirus is the culprit.
Okay.
And so if we want to stave off those cases or decrease the incidence, the number of new cases of cervical cancer, we've got to prevent the transmission of HPV or human papillomavirus.
Okay, so what are the symptoms of cervical cancer?
That's just it. There are no signs or symptoms in the early stages of cervical cancer. So a woman can have it and not even know it. It's only at the advanced stages she might notice some bleeding in between her menstrual periods.
Okay.
She may notice bleeding during or after intercourse, but it's usually that abnormal bleeding that shows in the advanced stages of the disease.
Okay, so can this be prevented?
It can be prevented. We do have vaccines that can actually prevent the transmission of the HPV virus. Now it's a little bit controversial because the vaccines ideally should be administered to boys and girls between the ages of 11 and 12 before they become sexually active.
Okay.
And so the idea is that we vaccinate them against the HPV prior to sexual activity, then their chances of them contracting the virus and being at risk for any forms of cancer would be less likely. In terms of the boys, they would be less likely to transmit that HPV to girls, making them at higher risk for cervical cancer.
Okay, so this is for girls, not for women or men in later years.
Usually after the age of 26. So up until the
Okay.
age of 26, vaccination is still a viable option.
Viable option.
Yeah,
Okay.
and again, the thought process is that by the age of 26, then the person may have had multiple partners and their sexual activity is
Gotcha.
heightened. Yeah.
Okay, so women need to have the Pap test.
They have the Pap test. That is the screening tool.
Okay.
So the most powerful thing that we can do to protect our health, our cervical health, is to get screened. And that is the Pap smear. Yeah,
Okay.
and so it should be done annually, for women who are 18 years of age and older, or when they become sexually active, whichever comes first.
Okay.
Right? And then also smoking. Smoking is a risk factor for all forms of cancer, including cervical cancer. So
Okay.
avoiding smoking or tobacco cessation, and then limiting the number of sexual partners, again, because you want to decrease your exposures to the virus, HPV.
And safe sex too.
And safe sex, using
the
condoms, yes.
Okay.
Create
All
a
right.
barrier there. Yeah.
Okay, all right. Good information. Thank you
Yeah.
so much for Dr. Paula Walker-King for being here.
You're welcome.
And you're wearing this color because?
Teal is the
Teal.
color for Cervical Health Awareness Month.
Great. All right. You look great. Thank you
Thank
so
you.
much. All right. Let's send it over to Elizabeth.